The Pioneer Elite Dental Laser is a full-function, battery-powered precision instrument. Its main parts include the laser unit, the handpiece assembly and trunk fiber, disposable laser tips of 2 lengths, a charger station, a wireless foot controller, and power supply. The unit comes with 3 sets of safety glasses. Before beginning the laser use, it is necessary to install a 9-volt lithium battery into the base of the foot control. The battery compartment is opened with a Phillips head screwdriver. After installing the battery, reinstall the screws. For laser use, be sure to depress the pedal as opposed to the safety cover of the foot controller. Begin setting up the laser for use by plugging the power supply cord into a 120 volt outlet. Now attach the power cord plug to the power supply. Then plug the power cord into the cradle directly or into the laser unit. Avoid unplugging the power supply from the wall outlet while the laser is attached to the power supply, as the battery may become drained. If not already previously installed, attach the fiber cable handpiece assembly to the laser unit. Care should be taken not to contaminate the male or female ends with foreign particles or finger oils. Contaminations can lead to malfunction. Retain the protective caps for the ends of the fiber assembly. Select the appropriate length unit dose fiber tip. Again, care must be taken to avoid contamination or scratching the male end of the optical connector. The use of gloves are recommended in avoiding contamination. Both the standard 6 and 9 mm perio tips are 400 microns in diameter. Insert the tip fully into the handpiece. When the handpiece is new, this may require some effort. The fiber tips are intended for single use only. Dispose as a contaminated sharp immediately after use. Place the unit in the cradle if you wish to operate it in the upright position. Slightly tipping the unit forward will facilitate full seating in the cradle. Be sure the unit has been fully charged before use. However, it may be used in both the battery or AC mode. An optional remote interlock is supplied on the left side of the laser unit. Put on the supplied protective safety glasses. All personnel and patients within 10 feet of this laser device and target tissue must wear safety glasses during any lasing operations. Federal regulations require the supplied laser safety sign to be in place when the laser is in use. The master power switch is also located on the left side of the device. Flipping the switch to the 1 position will power up the unit in either battery or AC mode. The battery will allow active lasing for approximately 45 minutes or in standby mode for 8 hours on 1 full charge. When the screen powers up, touch the Enter button. The keypad will appear. Then enter 1, 2, 3, 4, and the Enter key. This will bring up the main menu of the device. The operator can choose any item from the menu. Quick Setup will automatically default to 1 watt continuous wave settings. Touching the Ready button will allow the laser to be in the ready mode and turn the visible red-orange aiming beam on. Use the back button to return to the main menu. Other menu selections include a user-defined favorites list or a pre-programmed group of settings for procedures in alphabetical order, and a pre-programmed settings grouped by specialty. The yellow button will allow the user to go back to the previously selected setting. The upper right corner display shows the battery charge condition. A unique feature of the Pioneer Elite is the ability of this laser unit to be used in a horizontal and more stable position for use on a movable cart or bracket table. Simply push the invert screen button, remove the laser from the cradle, turn the laser over, and if you wish, place the handpiece in the upright position. Changing settings. Changing the power or mode setting is simple. Just touch the setting you wish to modify. Use the arrows to raise the energy or lower the energy, and push Done when you've finished making your selection. You may toggle between pulse and continuous wave simply by pushing the blue illuminated button. You may also use this screen to save a particular setting as a favorite. Spell the name of the setting using the keypad and push Save. Certain therapeutic procedures, such as an aphthous ulcer treatment, follow a timed protocol. Use the built-in timer to allow laser emission to continue for a certain number of seconds or until the foot controller is released. After pushing the Ready button to initiate the aiming beam, the brightness of the aiming beam may be adjusted by selecting it and following the arrows up and down in intensity. Or by turning it off. Push Done when completed. The Pioneer models of lasers are essentially low-powered devices. In order to reach surgical vaporization temperatures quickly, it is necessary to introduce dark ink onto the surface of the cleaved tip. This is best accomplished by utilizing thick articulating paper with a power setting of about 1 watt. Try to avoid piercing the paper with the tip, as this may cause some melting of the cladding. The purpose of the cladding is to prevent photonic energy from escaping the side of the fiber. Use of mylar-based articulating films is contraindicated due to the lower melting point of the mylar and the possibility of causing combustion of the film. Fiber initiation is not indicated for therapeutic or non-surgical applications. Test firing of the laser is recommended by firing the laser toward the floor of the treatment room or into a water-wetted piece of gauze. After use, remove the disposable tip. Dispose of the fiber tip as a contaminated sharp. The outer metal sleeve of the handpiece is fully autoclavable and may be removed from the rest of the assembly by unscrewing it from the inner portion of the handpiece. This can now be autoclaved. Reinsert a new tip or the protective cap after disinfecting the handpiece will prevent contamination of the trunk fiber connector and handpiece. The Pioneer Elite Laser is ready for patient treatment.